My name is Rosie Perez, and I'm the VP for Mission. Living out the mission of St. Peter's Health Partners is one of the things that I love the most. We get to live out an important mission at St. Peter's Health Partners in caring for people who are the most vulnerable. The mission of St. Peter's Health Partners is about providing quality care and being a transforming presence in our workplace, in our community, and in the world. The core values of St. Peter's Health Partners are foundational to the work that we do every day. The core values speak to reverence of each and every person that we serve and we work with. We feel that each person has an inherent dignity, and we honor that by how we treat them as we carry out our work every single day. Care for the poor and the underserved. I would say that that's probably one of our most important core values, because that speaks to reaching out to those who are most vulnerable, those who are without resources, or those who are underserved. Our core value of stewardship, it's just not about making the best use of our resources. It's also building trust with others. It's taking resources and letting the community know that they can trust us, that we're going to do the best that we can with the resources and the monies that we have available to serve our patients and families in the communities. Seeking justice for those who don't have a voice to speak for themselves. Having a core value of integrity speaks to the highest core value that we can possibly have. That means that we keep our word, we do what we say we're going to do, and that we act in a manner that's respectful, acting when no one else is looking. The vision of St. Peter's Health Partners is to be a mission-driven, innovative health organization, to be a trusted health partner for life. Mission Services has a wide scope at St. Peter's Health Partners. We provide spiritual care services to ensure that the spiritual needs of our patients and families are met on a daily basis. We provide ethical services to provide those services when difficult decisions need to be made. We also work with community-based organizations, whether it's being at health fairs or providing a mobile unit to provide dental services in an underserved area of town. The Mission Service Fund was created to be able to meet the increasing complex needs of the people that we serve. We have 3 priority areas for the Mission Service Fund. The first priority area is employee hardship. If you can imagine having to deal with a catastrophic illness, having something terrible happen to you, and needing some funds to be able to just try to get back on your feet. The Mission Services Fund is able to provide that. We are fortunate that we have employees that are loyal and dedicated and show up and work hard every single day to ensure that our mission and vision is carried out on a daily basis. The least that we can do is to be there for them at their time of need, and we are able to do that through the Mission Service Fund. The second area is care for the poor. As you can imagine, we have patients, we have members of the community that come into the hospital and as a result of their illness have unexpected expenses. The Care for the Poor Fund is able to provide resources to those who are in most need. The third is Global Health Ministries. We are fortunate enough to be able to care for not only our employees when they need it the most, or to be able to care for the community when they need it the most, but we're also able to care for people who are on the other side of the world. We are able to send our staff with their experience and their education to provide health care in areas such as Peru, Haiti, Guatemala, for us to be able to send our trained staff to provide compassionate quality care with medications and supplies that can't be found in those places is just incredible. I'd like to thank everyone from the bottom of my heart that contributes to the Mission Service Fund. Without those resources, we wouldn't be able to help our brothers and sisters, whether they're our own colleagues or employees, whether they're members of the community or members of a team wanting to go serve others in faraway places. We wouldn't be able to say, yes, we can help you, and to help you now and not wait. Without those resources, we wouldn't be able to do as much as we're able to do as St. Peter's Health Partners.